Throughout time, individuals have asked themselves questions about gender and sexuality, but mostly in very hidden arenas with often great risks associated with that inquiry. Coming out, as it were, was in fact quite dangerous just a few decades ago and continues to be so in certain parts of our country and the world. Today, it's a paradoxical time of openness about gender and sexuality, and yet also when legislation across the country is making it harder and harder for all people to openly explore their true selves. The medical arena is a microcosm demonstrating this paradox. There are places where people can get care and assistance with respect and guidance, and yet still there are many medical environments where the LGBTQIA+ community struggles to be seen and well cared for. Welcome, Gynocurious listeners. I am your creator and producer, Dr. Amy Novatt. From both sides of the speculum, we are here to investigate what it means to be a healer and to be healed. Please send your comments and concerns to comments@radiofreerhincliffe.org or to gynocurious@gmail.com. Let us know what you're thinking. So today, I'm so pleased to ask Kate Steinle to join me. Kate goes by she, her. She's the Chief Clinical Officer at FOLX Health, the leading health and wellness platform for LGBTQIA+ care. At FOLX Health, she oversees clinical services and leads trainings on equity for organizations. Prior to FOLX Health, Kate was Director of Trans and Non-Binary Care and the Associate Vice President of Clinical Services at Planned Parenthood of Greater New York, as well as a provider of in-person sexual and reproductive health care for over a decade. In 2023, Kate was appointed to the Clinical Council of the American Telemedicine Association in recognition of her leadership in the field. Welcome, Kate.
Thank you so much. I'm excited to be here.
Thank you for being with me this morning. I'm so pleased to hear from you and learn about FOLX Health. So I usually start conversations in Gynocurious asking people kind of how did they end up where they are today? Can you talk a little bit about your kind of professional and personal arc that led you to FOLX Health, please?
Yes. A long, long time ago, I was actually an EMT in high school in a town that I grew up in. We had this kind of ability to become an EMT prior to age of 18. So I was doing that as a volunteer, and I knew that there was something that felt really amazing to be able to be trained to do something to help people, right? So that I could show up and make change in somebody. And obviously as an EMT, you're making change at a time of severe distress or, urgency. I then went on forgot a little bit about that healthcare field for a minute. I was a teacher for a while, but then I just felt that kind of calling again to do more for people in healthcare and help them drive their health forward. I did some birth doula work and was trained in that for a while. And I thought I wanted to do midwifery, went to nurse practitioner school instead. And that kind of led me to sexual and reproductive health and my focus in that for a really long time at Planned Parenthood. And part of what I was doing there, even before I launched the trans health program there, was making sure all of our services and all of the way that we interact with our patients there was as affirming as possible to the LGBTQ community. So changing the way that we did our intakes, changing the way that people are trained on asking questions to make sure that they are addressing that individual in front of them instead of making assumptions. And then COVID happened, and, right at this juncture when we were kind of going into shutdown mode and we were moving a lot of things at Planned Parenthood over to telehealth, I had this amazing opportunity kind of land in my lap with the founder of FOLX Health. And I started out doing some consulting with them and then kind of jumped ship over from Planned Parenthood over to FOLX Health. I just was the way that we were structuring and the purpose of what we were doing there just felt so monumental and so shifting of the way to provide healthcare in a joyful and affirming way that I couldn't let go of that opportunity. And so I've been here since for 4 years. And that kind of gets us to that spot right now, what it has meant over the past 4 years to be in a place that is telehealth focused and really just creating a wildly new healthcare experience for the LGBTQ community.
Yeah. I think for the world at large, right? I mean, telehealth is is a new phenomenon. And, as a clinician, we used to make house calls. Then we had phone calls, and now we have 10-minute appointments. And it's the arc in traditional medical arenas is going from spending a lot of time with patients and their families to a little bit of time. And my hope for telehealth is that it provides not only affirming care, but affirming in kind of this global universal way of saying, you're someone I'm going to look at, listen to, and spend a little bit more time understanding and incorporating your kind of entire healthcare, right?
For sure.
Yeah.
And I think that's exactly it. I mean, there is the amount of time a clinician is actually spending talking directly to a patient on telehealth is so much longer than what they're going to be doing in person, because they have you have a 15 or 30-minute visit on telehealth, and you have your clinician that entire time, and you have their total focus. You don't have someone else walking into the room asking them, or them getting a call on the office phone. I think that is a huge thing. We have seen a lot about how much, if a patient can be in their own space during a visit and not have to sit in a waiting room, not have to kind of go through all those processes, but they're in the comfort of their own home, the safety that they feel is going to allow them to be more open with their provider, right? The provider it is a virtual house call in that way, right? So you get to say, I see that, and I see people open up in a different way. I think we all, as telehealth providers, before we got experience with it, we're worried that the screen was going to cause a barrier, right? It was going to create a barrier that people weren't going to be able to kind of connect through that. But it's actually the opposite. I think that it is a way that people can really just the direct eye contact, the ability to see somebody, the ability to just hear their entire story, and you're focusing here. And guess what? You're writing on a note right in front of them, right? So you don't have to be doing this and going back and forth. There is that direct contact right there. So yeah, I think it's a big shift for all of us to understand that just the act of sitting in a room next to somebody doesn't create that connection. It's actually about what you can do to be able to build that safety and trust. And you can totally do that through a telehealth visit. And in fact, I think that, again, we see just more trust being built in this way.
Yeah.
With this ongoing process.
It's so interesting because when I first started doing telehealth in my practice, I was really resistant because I'm kind of a touchy-feely doctor. I like to put my hand on someone's back or shake their hand. I feel energetically it's important. I want to honor them with, eye contact. But it's so interesting. Just as you're describing, there's been this evolution in my own practice, in my own experience vis-a-vis telehealth that is, in fact, it's quite positive. And what I'm realizing is just as, again, you're describing, so many people come into a doctor's office, literally where the minute they get outside their car or they get off the bus and they're opening the door to the clinic or to the doctor's office, there's a guard that goes up. And I get it, man. I experience it myself where I'm feeling okay, do I have my insurance card? Are they going to ask me questions that I don't really want to answer? Am I going to meet, I went to a doctor's office the other day, by the way, and the nurse was sitting in the middle of the waiting, in the middle of the office. I'm standing at the front desk, and I purposely didn't say anything. She was on her phone. It was 9 minutes before she looked up and realized I was there. And I was somewhat entrapping her. Right. Not fair, but I'm just taking notice.
Checking.
Of what works and what doesn't work in offices, particularly as I start to pivot my own work. But it really struck me because she looked up, she put her phone down, she came to the window and never said, "I'm so sorry I didn't see you there." She just handed me a clipboard with a pen and said, "Fill out the questions."
Right,
and,
right.
Again, she might have been having a bad day. She may have been ready to leave this job. She may not be cared for in this job. I mean, there's so many reasons why her demeanor might not be good. But that, again, I think there's so much sickness in the world of medicine today. not literally physiology sickness. I'm talking about the ill health of the medical industry.
Machine.
Yeah, the
Yeah.
machine. And so if telehealth can eliminate some of the fear, some of the hardships of walking into an office, and particularly for someone of minority communities, LGBTQ communities, anybody
Yep.
who might feel a little bit marginalized for whatever reason, it's
Yeah.
a wonderful opportunity. Yeah.
I think that we hear that a lot from our members who are just so grateful that they don't have to sit in an office in a waiting room with other people who are possibly staring at them or trying to clock them in their gender identity, or looking at posters on the wall that don't represent their identities, right? So talking all about birth control and just showing a cis heterosexual couple, and going to the front desk and possibly being misgendered or not getting their pronoun right. Like, those are all of the different things that, if you think about it, you already talked about, like, you kind of get out of your car and, like, what already do you have to kind of put barriers up and protections around? And then just think about it as somebody who, I've had some trans women come to me through telehealth and say, like, I didn't actually go into my doctor's office because sometimes it takes me so long to kind of literally put on my face to the world to make sure that, like, I'm going to be as safe as possible on my way to that office, that nobody's going to kind of harm me physically or, like, with words on the way. And it's that kind of thing where, like, if you go through all of these it's almost like what is that what's the word when you are going through a series of trials, or like physical trials, right? And you think about each one of those, that is adding another layer of protection, adding another layer of, like, I don't feel myself. I don't feel myself again, and I don't feel myself again. And then by the time you actually get to the actual clinician who's supposed to be having this conversation, and they're like, tell me how you're doing. Tell me everything about, and they're like, wow, in order for me to actually get there, I'd have to peel this layer away, this layer away, this layer away, layer away. And by the time I actually get there, you're going to walk out of the room. And I'm going to be left with, like, wait, why did I just do that? And I think that, again, go back to the spot where I think also there's, like, often long periods of waiting time in a waiting room. Whereas, like, if you're sitting here waiting for me to jump on my telehealth visit with you, it might be right on time, might be a few minutes late, but during that time, you can actually, like, pet your dog, or you can, like, sip your coffee, And I think that kind of thing of just being like, okay, I'm actually still able to kind of breathe into that relaxation, and it just enters you into that conversation and that relationship with your clinician in a much more, like, relaxed, I'm here way.
Yeah, and again, talk about barriers. If one feels really vulnerable, hey, you could close the computer, you can turn it off. And that's
Totally.
much easier than saying to a clinician when you're sitting in a room partially naked and you really want to just say stop. And,
Yes.
Cisgender women have difficulty doing it in a gynecologist's office when they're feeling victimized and afraid. So just imagine someone who's trans or non-binary. So absolutely. So let's get a little bit more granular about, what does FOLX Health do? We've obviously mentioned telehealth. So let's tell the audience what great things you guys do.
Yeah, sure. So we started in 2020, and again, the focus of what we do is to provide an affirming and joyful healthcare experience for the LGBTQ community. We started out, the vast majority of what we were doing at the beginning was gender-affirming hormones for our trans and non-binary patients. And then over the past years that we've been around, we keep hearing things from our members about what additional pieces they want from us. So they were saying, like, hey, I love getting my gender-affirming care from you, but gosh, I wish you were my primary care provider. Last year, we launched primary care across the whole country. And so we did a whole bunch of training with our clinicians on how to provide primary care through telehealth, how to be that kind of hub and create that referral system when we need to send people in person for screenings and lab work. We also provide mental health treatment, so we can do anxiety, depression, prescribing through primary care, just like any other primary care provider can. And then we also do have individual therapy provided with our therapists currently in about 5 states, and we're launching and licensing people up across the rest of the country too. So when I think about primary care through telehealth, it really can run the gamut of so many different things, right? So like think about your primary care person that's in office. They're almost like the control tower of your health, right? So they're not the ones who are drawing that lab or they're ordering an ultrasound. They're the ones who you are sharing your medical history, having these conversations about what your concerns are. They're talking through the risks and benefits of each treatment. And we're doing that through telehealth. So we treat hypertension, we treat diabetes, we have screening for STIs and treatment for STIs. We treat menopause. So all of those things that we can do, through the telehealth system. And then again, we have a vast referral network that we have vetted partners with across the country that we know are going to be as affirming as possible to all of our patients that we send over there and get those from the community.
Sorry for interrupting.
How do we get them?
Well, a couple questions. One, how do you screen your clinicians? How do you know that when you call Dr. So-and-so, that person is going to be respectful to your community?
Yeah, it's a great question. We have a couple different levels of how we get people to. So there's kind of the base, and then there's a baseline level of that person self-identifies either on their site or, through let's say the Gay Lesbian Medical Association, they might be listed on there. That is kind of a self-acknowledgement that I am affirming. It's almost like putting a sticker up on your door, right? That's baseline. And so that is, we know that that person will likely be, have the right forms when we're going and sending our patients in for intake, make sure that they've done some training with that front desk staff. But that is not a guarantee, right? Anyone can kind of check that box themselves. Then we have next level up, which are ones that are clinicians or our members that have already gone there and have already established relationships with that provider and know that they have expertise in the area. So not just like a competent provider, but an expert in that area, and that they are dedicated and have experience providing healthcare for this community. So that's another level up. And then there's another level where we actually do trainings with some of those clinicians to make sure that they are going to be at the level that we feel comfortable with, saying, all right, this isn't a FOLX clinician, but this is somebody that we actually have done assessment with and additional training with to make sure that they can meet our members where we need them to be.
Great. Yeah, I mean, of course, what I was fantasizing about as you described this was that this training is with every clinician throughout the country.
I know.
But I'll be patient here.
We'll get there.
And exactly. And it occurred to me also that there are going to be people out there who say, "No, thanks. I don't want that training." And so what have been the barriers? What have been the greatest challenges to establishing FOLX Health across the country, doing the work that you do?
Yeah. Well, initially, some of the barriers were just about we have this cadre of amazing clinicians and then getting them licensed across the country, especially during the time of the pandemic where a lot of people were getting state licenses. And so there was a backlog of licensing, right? And we also know that I'm sure you know of the IMLC, which is the medical ability to kind of have a medical license in multiple states, right? There is not that same process for physician's assistants or NPs. It's in works to get there. But so all of these are individual licenses, right? And in order to practice in that state, or in order to see patients who live in that state, the clinician can live wherever. They just have to get a license in that state where that patient is. It takes time. And it was that took a long process because we knew we had the right people. And then it's just the process of getting them licensed.
It's so insane, isn't it? I mean, given that telehealth is becoming the norm of the day, that clinicians can't be licensed to speak to, that they can't speak to someone in California if they don't have a California license is just insanity.
It is. And we have some of our patients who actually cross the line, park in the car, somewhere else over that state line just so that they can get that prescription and that live conversation with their clinician. So, and we know like federal laws like this that would allow us to recognize prescribing or licensure across the country are going to be very slow moving, and
Yes.
they have been, right? It's been 4+ years now. The other piece that was tricky is we do prescribe testosterone, which is a controlled substance prescription. And so making sure during COVID and during the public health emergency, there's the telehealth flexibilities to be able to prescribe controlled substances without having an in-person visit first. But there's still so much kind of ambiguity between, there's the federal part where the telehealth flexibilities have still been extended, but then there's certain states that decide to go back on that before the federal law. And so we've had to watch those and make sure that we're doing this right, because obviously we want to follow all the state requirements, not put any of our clinicians, our patients, or any licenses in jeopardy. That's been tricky, and also waiting for the DEA to put their final ruling out, which I think ourselves as a telehealth company, a lot of the substance use disorder companies that are out there who are, providing care for people who are going through medication-assisted therapy also are waiting for that and really kind of hinging a lot of their business on what's going to happen. And we've had to, talk about crazy in order for us to get a DEA license for certain clinicians in certain states. We've actually had to rent office space in that state, set up a desk and chairs, a locked cabinet, and in order for the DEA to go visit a place. And I'm like, but we don't actually dispense medication out of there. Like we don't, we're trying to meet all these rules. We don't dispense medication, but it's again, this archaic system, maybe not archaic, but just not built for telehealth. We're trying to adapt it in this telehealth system. And then the other big one is, we could probably spend so much time talking about this, the political landscape, right?
Yes.
Which is specifically for, if we look at it, the ACLU is tracking 500 plus LGBTQ specific bills that are passing through the state legislatures some of them are bathroom bills. So some of them are not healthcare, but actually that is kind of healthcare if you can't use the bathroom.
I'd say so.
And, some of them are about book banning and, education system. About 100 of those bills across the country, though, are specifically directed at limiting access to healthcare for LGBTQ people, mostly trans people, mostly trans youth. And so while we don't actually treat trans youth, everyone that we see is 18 and over, and certain states actually higher than that because they've increased that age limit for us. It is still something that we have to monitor. And every day our general counsel is looking to see what new updates there are. And we are adapting to those and making sure that we are communicating. I think the biggest thing here for our community is like even in this midst of this literal attack on their lives and their access to healthcare, that we can say we might not be able to stop that. We do a bunch of lobbying efforts, but we can watch it. We can communicate with you so that you are feeling like we've got your back. We're taking care of you. Even in this craziness, like we will let you know what is happening so that you don't have to feel like your brain has to constantly be tracking all of the dangerous things that can happen to you. We will let you know.
What an amazing service that provides to people because, as we know, particularly in women's health, there's nothing apolitical in women's health.
Right.
Women's bodies have been ignored, shamed, not studied, et cetera, just forever. And then, of course, around choice and contraception, right now we're at a time of talk about every day something is changing in the world of legislation. It's really, really hard to know which way to turn.
Yeah.
So to provide that support to your clients is really worth shouting out to. It's just what an honoring thing to do. And it's obviously for them and for you. It's keeping you abreast of what you got to know. Yeah. It's
right.
Sometimes I get fatigued by just how hard it is to, as you started this conversation with, just to give care. I just want to take care of people. That's all I want to do. I don't want to worry about what EMR we're using. I don't want to worry about whether I could, anything that I can write a script for contraception that their insurance is not going to cover, et cetera, et cetera. There's so many layers of issues that fatigue me.
For sure.
How do you cope with all this? Because this is not easy stuff. I mean, again, on a professional level, it's fatiguing, but on a personal level, what do you do to keep yourself healthy in the face of all this?
That's a good one. I think I'm getting better at that, I have to say. For the first few years of working at FOLX Health, it was tricky. There was so much of constant movement, constant adaptation, and feeling like if I rested too much, then like something was going to drop, and that could affect access for people across the country. I know that sounds kind of huge and maybe not the truth, but it felt that way. Like if there was like that individual responsibility, like if I don't do this, something is going to be problematic for people who need life-saving care. I think as we've gotten more stable in terms of who, first of all, I have a general counsel who I like is my closest person that I am checking in with all the time, because like now she gets to watch that. Sure, she has some stress about that piece, but she gets to watch all of these things and then communicate and uplift to me when there's something that we need to take action on in a particular state. So I think us just kind of growing as a company has allowed some of us to just be able to focus on the parts that are the most important for us. Like I can now work more on protocol developments and adaptation and changes there, and less on, oh my gosh, what's the burning fire everywhere else? And then that gives me time to be able to like walk my dog, who you might just have heard bark a second ago. Or, I have 3 kids at home and just be able to spend more time with them. So instead of, kind of feeling like I have to jump on the computer at the end of the night, that I can just go cuddle with them, right? Because that is the part where it's like, I want to make sure I have at FOLX Health, we have tens of thousands of members that are really important. But like, if I don't get, that time with my kid, it's also affecting them.
Yeah.
So,
well, you're talking about leadership. You're talking about learning how to trust others, create relationships, and give people responsibilities that they're living up to and respecting them for that. So I suspect that attitude that you've just described filters down and impacts everyone, again, from the C-suite to your patient. So that's so terrific. So sexual identities, are not fixed. For many, it can and will change over time. So for individuals out there who are wondering, is FOLX Health for me? Am I a candidate? How would you unpack that for us? Someone listening who's saying, can I call them? I don't know.
Yeah. It's actually a great question that we get with some people, especially as we work with employer partners. And what if employees want to use us as their healthcare provider? Do they have to be part of the community? Do they have to have that like stamp of approval? I think one of the things is like, you're part of the community if you are an active ally, if you are a parent of a trans kid, if you have like your sister who is recently come out, like those are people and pieces that we can see as well, right? So I think one of the things in terms of at FOLX Health, we have an entire platform called the Community Platform, where we have educational resources, ways for community members to connect. We have peer support groups, and some of those support groups are around parents who have kids in the community, right? So like there are many different ways. It's not like you go through an intake and you will be rejected if you do not say that I am identifying as part of the rainbow alphabet, right? That is not, we don't have a barrier of like, you have to check a box here in order for you to get care. You might actually be a person who doesn't know how you identify, or maybe you are, as you're saying, very fluid in that. And you want healthcare that recognizes your individuality, that is going to be about having a conversation with a clinician who's going to kind of show up and be with you wherever you are at that moment, and then adapt to that at the next visit. If you use one pronoun at one visit, and then you've told me at the next visit that you're using a different pronoun, and we're going to change that in our EMR. Great. That is what we want all healthcare to be like, but that is what we do here. So that fluidity, I think a lot of people, and especially trans people, worry that they actually have to, because this has historically been the case, that they have to show up in this actually kind of binary way in order to get the stamp of approval that this person's going to give me medication that I know I need. And so they historically have answered questions that maybe don't apply to them, but they think that's what the clinician needs to hear to be able to grant them their access. And I think that's the piece that we have really tried to, dismantle for people, is like, there is no, and I often start out my conversations with people, there is no right or wrong answer to these questions that I'm going to ask you. I'm going to ask you a question. I'm going to tell you why I'm asking it. First of all, that's always what I do. And then you tell me your answer. And my purpose right here is to write that down in your own words and then talk through it with you. And I think that piece is like, you don't have to meet a certain, there is no cutoff that I'm going to say, oops, you just got the big red alert button. I'm going to have an informed conversation with you about everything.
Yeah. It's great. It's great. I mean, language is so powerful, right? And for so many people, the pronoun alphabet is challenging, particularly peers my age. You grow up in a binary world, and it is really not easy to use plural for a singular person. And it's, I'm not making excuses. I'm just saying it's like the brain is only so plastic, and we can still learn, but there is an adaptation that has to go on. So what I really love about what you're sharing with me is this capacity to just say, I'm here with you now. I'm trying to learn who you are at this moment, and that I'm going to try to work with you. And that's not always easy. It's just not always easy, particularly, again, in the world of medicine.
Yeah, exactly. I was thinking that too, because I feel like, as people who have been trained to be expert in something, we are the ones who should know it all and pass that information down to our patients. It is a big shift to be able to say, yes, I'm still an expert. I'm the one who's reading the studies. I'm the one who's going to the conferences. I'm the one who's kind of in charge of watching to see what updates there might be about your healthcare. But you're the expert in your body, in how you interact with the world, in how you respond to the medication we talk about. That's your expertise. And my expertise does not mean that I get to then say, well, that yours is less expert. It's to figure out how to bring that into the conversation and incorporate that into the treatment model. And I think that is one thing that is really important and a shift for a lot of people who are kind of used to that power dynamic.
Yeah. And, another thing that's come up for me in the clinic setting, and bear with me, is, more and more of my patients have had gender-affirming surgery. Mm-hmm. And talk about having to kind of expand the mind, not just for myself, but for my nurses in particular. Mm-hmm. When you are encountering an anatomy that has been altered to accommodate someone's sense of self, which I'm so grateful for and fully supportive of, it's also kind of a mind bend. Because again, we are not only are we using pronouns that are, have been binary and gender full for centuries, but we have anatomy, vaginas and penises are defining for so long and much less so now, or different now, or whatever you want to do with it now. Yeah. And it's kind of provocatively wonderful for me as a clinician. Mm-hmm. But I can tell you I'm so thrilled when my nurse will take me out of the room, or I'll leave the room, and they'll say, "Can you explain that to me? How does it work now? Yes. Does this mean that, urine comes from here, not there? Can you explain it to me?" And I'm thrilled because they're really genuinely interested. But I can appreciate they're stretching themselves. They're really stretching themselves. Sure. Yeah.
Yeah, and they're used, and you think about it from an EMR standpoint, or even our questions that people like our medical assistants or our RNs are meant to be asking. if somebody has a vagina, then we need to have them do a urine pregnancy test. We need to ask them when their last pap smear. Like, there's all these things where it's like, oh, wait, that actually might not apply to this person's vagina in front of me, right? And so it is a whole thing of like, how do we not make assumptions to be able to kind of, again, meet that person in front of us? And I think when I did training a bunch with Planned Parenthood, some of our medical assistants, when we changed the way that we worded questions, people were worried that they were going to make people feel uncomfortable, patients uncomfortable if they asked, do you have, we're going to ask questions about your partners in order to assess for risk of pregnancy and risk of STIs. I'm going to ask these questions to I ask these questions to all of my patients. Do you have sex with people with penises? Do you have sex with people with vaginas? What parts go in what? And I think one of the things, it took a long time for our staff to get comfortable with asking those questions, because yes, you actually might make some people feel uncomfortable. You totally might ask that question and someone's going to be like, why are you asking me that? Guess what? You can just say, I asked this question to everyone because I don't want to make assumptions, and I want to make sure that the person in front of me answers the question so that I know how to deal with what they need. And I think that's the thing where it's like, you're right. The textbooks that we all went through and the type of school that we went through is not built for this.
Right.
It's built for algorithms structured around certain bodies, and we have to open it up. And it's a learning experience all the time. I feel like there's a lot of humility in that. And there's also like a lot of apologies. I mean, I apologize all the time still, right? If I get someone's pronoun wrong, or if I address their partner in a different way, like, all I have to do is just like recognize I made a mistake and or call somebody else on making that mistake and move on. And I think it's also okay, as somebody who even works in this field, to recognize I'm not going to get it right the whole time. I just have to do better the next one.
Thank you. Thank you for sharing that, because I think so many people who don't work in the field feel kind of almost disabled in that they just feel like they're going to make a mistake. So then they avoid these communities.
Yep.
And that's not really what they want to do. They just feel like they're not going to be PC, and they're worried about
they're
that.
not going to be as good as, yeah, exactly.
Yeah. It's so, there's so much to be said about, as I said earlier, there's so much misogyny out there and lack of science. So part of what we're talking about too is that there's this whole new arena in science, in healing and health around trans folks, people on the spectrum, if you will, who are asking for care in a way that we, again, have no experience with. So my purpose inviting you to speak to Gynocurious today is not just to get to know you, and I want to make sure people know about FOLX Health, but to just remind people that this is a learning process, and that we are, if you can find a practitioner who is open to speaking to you and supporting you in where you are at the moment, that's the objective. To know that practitioner may be hindered by a lack of science. We don't have long-term studies on the use of testosterone for trans folks. We don't have a lot of experience using testosterone for cisgendered females. I mean, there's so much we don't know, because one, we have so little science on persons with vaginas, let alone people who now identify as female who may have started their lives with a penis. So it's there's a lot of work to be done, but FOLX Health is clearly setting some wonderful, setting the bar high, and I love that.
Yeah.
And go ahead. Yeah.
I was just to piggyback on that, if there's any listeners that you have that are interested, like, I always love to talk to clinicians, or just like, I'm easy to talk to. I'm like not judgmental at all. If anybody has particular questions or wants to reach out, feel free.
How do they reach you?
Out to
How
me.
do they reach you?
Kate at folxhealth.com. It's pretty easy. So they can
Spell
either use my full name.
Please, because it's not as it sounds like.
You got it. So it's Kate at folxhealth.com, and it's FOLX Health.com.
And just so everyone knows, it's now available in 50 states. It's the largest health and wellness platform for the LGBTQ community. They take insurance, which is just unbelievable. I just so applaud you and the work that you guys are doing. So I just want to remind people that this is a place that's safe, honoring, respectful, learning with you. So please take advantage, learn about them. And Kate, I can't thank you enough for joining me on Gynocurious this morning. So you've already alluded to what gives you pleasure. That's how I like to end the show. A dog and your 3 kids. I like that. One more thing that you do for just you that gives you pleasure. Yeah. What is it?
I know it. I have a cabin in Vermont that has been in my family for 5 generations. And since I have been working through telehealth, I've been able to go up there all summer. And it is a place that, I feel like it's kind of my heart's home. I spend so much time on the top of the hill picking blackberries, taking walks around there, and just kind of like the trees are different. Right. And the air and the sunlight is different up there. And that is a place that gives me joy.
Nature. Yeah. Mother Earth is truly perhaps some of the best balm we can use to deal with the world today. So thank you. I want to remind everyone I'm speaking to Kate Steinle, who's at FOLX Health. Please take a look at the resource that is just remarkable. I want to thank the audience. I want to thank my co-producers, Maddie Rosenberg and Jen Hammoud. And I want to thank the Epicurean for hosting us here at this wonderful store that supports local farmers and goods. Please, until we see you next episode or speak to you next episode next week, stay well. And please listen to your instincts and your intuitions. They're the greatest of teachers, not to be ignored.